Hi, it's Sheila Martin of HappyHysterectomy.com, and in this first video of the Hysterectomy Quick Tips series, we're going to look at whether or not you should choose to have a hysterectomy. But first, what is a hysterectomy? Well, simply, a hysterectomy is the surgical removal of the uterus, also known as the womb. In other words, the part of a woman's body where she carries a baby. Sometimes, but not always, the cervix, ovaries, and fallopian tubes are also removed. The term comes from the Greek word hystera, which is also the root of the word hysterical. Who decided that one? Now, you probably can't see this image of the female reproductive system too well, but you can track it down at wikipedia.com. It might be useful to go over before your next talk with your doctor. Why do some women choose to have a hysterectomy? Well, the surgery can dramatically improve quality of life, especially when you are suffering from debilitating pain or prolonged severe bleeding. It can be the treatment of choice for particular female diseases, such as pelvic inflammatory disease or endometriosis. And sometimes, as in uterine or cervical cancer, a hysterectomy actually saves lives. Now let's look for a moment at how often a hysterectomy is performed in the U.S. By age 40, 20% of all American women have had a hysterectomy, or 1 out of 5. By age 60, more than 30% will have undergone the surgery. And among 65-year-old women, an astonishing 39% will have had a hysterectomy. Now let's compare the annual rates of hysterectomy in the U.S. to 2 other Western countries, England and Norway. This year, and every year in the U.S., 5 out of every 1,000 women will have a hysterectomy. Compare that to less than 3 out of every 1,000 women this year in England, and less than 2 out of every 1,000 Norwegian women. Can it be that American women are so very different from women in other countries? I don't think so. Or could it be that many thousands of hysterectomies are being performed unnecessarily? I think it's the latter. And yet, for many women, the surgery is essential. So how do you know whether or not you should have a hysterectomy? I'm not a doctor, and I would never give you medical advice, but let me give you some food for thought. First, you want to ask yourself, are my symptoms life-threatening, or severe enough to interfere with normal life, or are they just a minor monthly inconvenience? Second, have you explored all the alternatives? There are many new treatments today that you may not be aware of. For example, myomectomy is a conservative procedure in which fibroids can be removed without removing the uterus. Hormonal treatments work well for some women, and UAE, or uterine artery embolization, might be an option for you. You can also ask your doctor if it's likely that your symptoms will diminish once you hit menopause. And finally, remember that having a hysterectomy is not like having your tonsils out. Before you schedule surgery, be sure you are in good health, both physically and emotionally. Well, that's it for Hysterectomy Quick Tip number 1. For more tips, be sure to click on over now to HappyHysterectomy.com and sign up for the rest of your tips. Talk to you soon.